and the rest of today's call will be memorialized. So thank you very much for joining. This is the first of 7 prep calls that we're going to have, or maybe 6, I can't remember now, prep calls that we'll have between now and September 14th when we meet in Atlanta for the Consolidated CDA Implementation-a-thon track that's part of Fire Connect-a-thon. My name is Lisa Nelson, and I'm going to be your track lead. I'm from MaxMD. I am the co-chair of the CDA management group along with Brett Marquard, and I'll also be one of the facilitators who will be guiding us through this track on September 14th and 15th in Atlanta. Today is kind of a get the gears rolling day. We're going to cover a bunch of resources that I've started to accumulate for everyone to help you have a successful participation. And we will talk about some of the track goals and track topics that we'll be covering. I'm hoping that today's session will be fairly interactive, so I've added some rest and breathe slides for me to let you guys do some talking where I can take some notes about some feedback and input that you might have for what you're seeing coming together for the track. And we'll talk about what the goals of these prep sessions are going to be and the topics that we'll cover as a way to also make this a kind of a collaborative thing so that we're sure that the track meets people's needs and is as effective as we can possibly make it. I'll start with resources. There's quite a few things that have been put together already, and I'll just drag a couple of them over onto my desktop here so that they'll be shown in the recording as well. One of the most important things to know about is the Confluence site, where the implementation-a-thon information is located. It gives you all the dates and locations and registration information and everything that you really need to look up to handle logistics and background. This is your most important spot to bookmark and remember how to get to. The implementation-a-thon overview information is right here. It also has the registration link for signing up. And unfortunately, I believe, Dave, unless you can tell me otherwise, that when you register for the Fire Connect-a-thon, it's very difficult for you to indicate that you are specifically going to be participating in the C-CDA implementation-a-thon track. That's why we try to do a good job of capturing everybody's information ahead of time so that we can be tracking you as opposed to the registration information doing that for us. Has anything changed about that, Dave?
Nope, it's all no, that is an accurate statement.
All the same. Okay, so when you register, sometimes you will receive a survey that if you respond to that survey, there may be some check boxes in that survey that helps your information get to us. But the main way that we will have, the leaders will have of knowing that you're going to be participating is through making yourself known during these prep sessions. So really appreciate that. All the track agenda stuff that you'll see today is linked off from this site. And one of the nice things we have now is a historical way of keeping track of prior IATs. And there's a real nice set of back pointers. So if you feel like you missed something from San Antonio or Washington, D.C., one of the earlier implementation-a-thons, you can always go back there and check them out. And you'll see it's one of the important reasons why we like to do a good job of keeping track of the sample files and the material that we develop at the IATs, because in essence, we are building quite a nice library that everybody can look back to over time. That is the Confluence site. Next up is a Dropbox link, and I have opened this for sharing to everyone. Some people have problems accessing Dropbox. Some people don't. It's a nice place to have continual storage. And so this shared storage area is where I have been publishing all of the resources that you will see us look at and access over time. So think of this as a library that I'm setting up for you. It's got a lot of useful stuff. I've got the map of CDA. This is, your basic picture of the base standard. A lot of people find that kind of helpful to have access to information about US CDI, the value set release package, misspelled, a few different back profiles that we might look at from IHE, things like that. So this Dropbox is where I keep resources that will be helpful to you, and ultimately it will be the folder sets where we accumulate samples that are generated during the IAT so that we have them for future reference. And you can go to back IATs if you're interested in looking at what documents may have been created previously. The Dropbox library is starting to accumulate now, so we have back IATs also shared out that way. Next resource that you will want to know about is the Zulip channel. And this is a chat stream that is for the Fire Connect-a-thon. It's on chat.fire.org. And this stream is where you can find and talk with other people about what's going on with the C-CDA implementation-a-thon that's coming up in September in Atlanta. We have our own stream called C-CDA IAT 2019-09 Atlanta. The way that you turn this stream on, if you don't see it automatically, is underneath this little gear tool right here. That's where you get to all of your subscriptions. And you can just add a subscription to this stream. And that's where we will be adding additional conversations, topics underneath there. But a couple of the important ones here is I left you a link out to a couple of surveys that we have. We're trying to collect a little bit more information about content creation workflows and content consumer workflows. Many people have questions about how do we expect information can come out of an EHR, or how can consolidated CDA documents get into an EHR. And we're surveying the community to find out what is the current best practice, what can we do. And both of those survey links are available here. And they're short, a couple of minutes a piece you can use to take those. And I also put up a reminder here that gives you a place where all of these meetings the dates are listed. These prep sessions happen on the same go-to-meeting line, so you can find that there. And of course, here's another way of getting to the Confluence site. So this is the Zulip chat is a great way to engage with other folks who are coming to IAT, ask questions, stay informed. The next resource that we will cover is the Google Drive, and we mentioned that briefly. Right now, there's only a couple things out there, one of them being the attendance sheet that Dave is working on populating for me right now. So this link, I suppose I can stick that. Oh, that's the link that I stuck in the chat already. It's an open that you can share there. So if you can find your way into this sheet, we appreciate knowing your email to go along with your name and keep track of who we've been able to reach out to so far. And then the US CDI, if you are not familiar with that already, this is the United States Core Data for Interoperability version 1 that's been announced with the Cures Act. And I'll be talking about that a little bit more today, but if you want to look up some more information on it yourself, there's a main link to that. And there is a link to the ONC scorecard, which is the primary validation site that we use for validating all of the samples and examples that we'll be covering in this track. So I think those are your 6 most important links to know about. They'll be available. This presentation will be posted on the Confluence site along with the recording. So you can always stay oriented by just picking up some of these links and finding your way to the information you need. These two I'm not going to talk as much about right now, but some people are interested in transformations between consolidated CDA and FHIR, and we have two resources there. One is a set of mappings that has been balloted through HL7 that shows the relationships between data elements in C-CDA and resources and profiles and data elements in FHIR. And there's also transformations that can be used that have been provided by the Lantana group, primarily in the area of care plan document types, but and right now they're currently only working on FHIR STU, but they're still informative for folks that are interested in this space, so I put those resources out there for you. What's going to be new? This is about the 6th or 7th time that we've done the C-CDA implementation-a-thon track. And based on feedback that we got from last time, there's a couple things that we're going to try to do differently or do in a new way this time to improve the experience and respond to some of the opportunities for change that folks voiced previously. First of all, the way we organize the day, we are going to sort of merge Q2 and Q3. Each day has 4 quarters, 2 in the morning, then there's a break for lunch, 2 quarters in the afternoon. So by merging Q2 and Q3, you actually end up with an extended period of time that spans lunch, and we will be using those 2 extended sessions to organize some more specific exercises where we're really going to try to get, say, more comparative information, where many people are developing samples around the same scenario using the same data, so that we can do a better job of understanding and scrutinizing where are we doing things the same and where are we doing them different. So we have struggled in the past with the quarter not being long enough to really get a good whack at that with the number of participants that we have. And so we've shifted our focus to have 2 extended sessions in the middle of the day to be able to address that better. We've also gathered more sample data ahead of time. So the scenarios and the sample documents that will establish sort of here's the starting point, and then you'll be asked to generate perhaps a slightly different record for a patient that a sample document has already been provided for, so that you easily have the reference scenario or the reference data of the starting point. All of that, the metadata, the header information, the stuff that's usually hard to get entered and whatnot, we'll be able to provide those in sample files. And I've already collected many of these into the resources area in Dropbox. We have also leveraged sample data out of some of the certificate testing samples. So there are some scenarios that work with patients that if you've been doing certification testing, that you already would have patients set up for these scenarios. So we're leveraging some of that work that's been done already. We're going to do a little bit more to clarify what are the expectations around creating and consuming CDA documents. In the past, we've really only focused on the document itself and what data is in it, but more and more we're finding implementers are implementing C-CDA, they're creating documents, they're trying to figure out how do documents get out of systems, and more importantly, how do documents that exist get shared into other systems? And what can we expect as standard methods for creating and consuming these CDA documents so that more can be known about what we can expect in the way that information can be shared through these kinds of documents. And another big change where previously I would say up until this past IAT, we have almost exclusively focused on the creation and consumption of one kind of consolidated CDA document, a patient summary called a continuity of care document. And this time, we will not be focusing heavily, if at all, on CCDs. This is a fairly tried and true kind of scenario, and everything that we will be focusing on in counter documents will still benefit the consistency of creating the standard sections that are in a CCD. But we really are focused on trying to drive progress forward on creating these encounter-oriented documents, and that's where our primary focus will be. Finally, there are 3 areas in the US CDI for which there has been little focus previously. A bit of discussion, but not as much clear demonstration of how to do data provenance, clinical notes in terms of the actual clinical note templates, not clinical notes that are document type clinical notes, but how do you put narrative clinical notes inside of one of these clinical note exchange documents. And then care team information, besides members who may be playing roles inside the header of some of these documents, we've made a great deal of progress on understanding, and there are templates now in the companion guide for how to represent a person's care team, what type of team it is, what members are on that team, and the contact information for them. So this is something that will be a new focus this time. And lastly, before I open up for some feedback around goals and objectives, I will mention that our primary goal for the Connect-a-thon track is to increase the consistency and accuracy with which we represent and share the data elements identified in US CDI version 1. We have found that over the years, although these templates are well known, well published, well understood, there still is a great deal of divergence from one implementer to another on how these basic data elements are being represented. And we're hoping to use the implementation of Thon now to drive consistency and move closer and closer together on a shared understanding and a shared way of representing this information, because that's what's key for interoperability. Our objectives behind this, some of the other things that we're hoping to accomplish is that we will improve the document samples that are available. Up until before the companion guide just balloted, we really only had a single CCD document included in the sample documents area that went out with consolidated CDA. So we're hoping to develop a much larger, richer pile of sample documents that go along with all of the types of documents in consolidated CDA. We're hoping to generate some valuable examples that will augment the work of the CDA task force. So even at the sample or entry level, come up with some examples that we feel could be included into that library of examples that help all implementers. And then to clarify the workflows that are available and what can be expected, so that more implementers can understand what the standard options are for expecting documents to be created, to be liberated out of a system, and then what are the expected ways that a C-CDA document should be consumed into another system, so that the flow of information is facilitated from one system to another system, end to end, that we just have been struggling with. Finally, we will socialize some of the guidance that is in the companion guide. The ballot process is not finished, but there is work there that is being disposed of right now. A lot of comments came in, and we just hope to increase awareness about that as a resource and what's there, and then also inform the testing and validation practices that are critical to the way we get aligned. Every time we build another rule into the ONC scorecard, it helps more and more implementers get that right and be aware of what they should be doing to achieve best practice in creating C-CDA documents. So those are our goals and objectives. And at this point, it's nice we have a smaller group, about 6 or so. I'll put a couple of folks on the line, or I mean on the spot, or just because it's a comfortable way to interact with just a few people. What's your feedback so far on the goals and objectives that we've set for the Atlanta implementation of Thon track? I'm going to call on someone. Linda, you're break the ice for me. What do you think, and what are your thoughts so far?
Sure. No, I appreciate the C-CDA, but when I saw that, the first thing I was thinking of is that's a C-CD. You know, the content within it is a C-CD, right?
That's an interesting point of view, but my first reaction is to simply say no, not really. Because when you look at the sections that are included in, let's take any other encounter summary. Take a history and physical. A history and physical certainly includes information about immunizations and problems, and can have a procedures section, smoking status, you know, vital signs. Many of these data elements that are mentioned in C-CDA, lab results, they're covered in all types of other encounter summaries as well.
You just may have to do multiples of the document types to cover all of them, right? But yes, that makes sense.
Yeah, you might. It's an interesting thing. So one of the things I'm going to take as feedback here is I have a chart that shows what sections are in what document types. That would be a good thing to put in the resource. Add to the resource folder the
I've
comparison.
seen it, and I agree. I've seen that chart, and it's very useful.
They're more similar than they are different, believe it or not.
Lisa, I know you know where the bodies are buried, so I believe you.
Great. Okay. Do you agree that the principal goal is to come away with us feeling like we're going to get more vendors and more participants doing more consistent and accurate representation of these data elements?
That is an awesome place to start.
Okay, great.
Because there's still challenges there. Live it, breathe it every day.
Yeah, yeah. Leslie, or I heard somebody else speaking up.
This is Matt. I think that the goal there is fantastic. I have not participated in prior implementation-a-thons, so I don't know how it compares to prior goals. And I mean, certainly the C-CDA is new data, you know, has new data elements in that set, but has this been an overarching you know, goal? Because before it was C-CDA, it was common CCDS, CDS, something like that. Has that been an overarching theme in the implementation-a-thons?
I think it's been a theme, but I don't think that we organized ourselves to walk away with as much like where we really want to bend the needle on consistency. I think that it's been educational. We've talked about challenges. We've taken on maybe some gaps where there was missing things that needed to be represented, and it's been an emerging kind of process. And I don't think that we've ever been at a place before where we really would come away saying, okay, results organizer, can we nail this, that everybody understands how we're going to do results organizers and they're all going to be the same? Is that an expectation? You know, I think that we've dealt with more like spot problems and being informative about certain things, but I don't think that we've ever had as much focus on saying, now you guys produce what you produce, let's see where the differences are and try to eliminate them.
Okay, yeah, well, I mean, if that is the case, then you know, from my perspective, you know, I work on doing transformations, and the more consistent we are at the source or the target, the easier my job is, and so I love that as a goal.
Thanks, Matt. Only 6 people. Leslie, feel brave enough to pipe in on this? What do you think?
I think that's a great objective. I am with a member of the American Dietetic Association, and Becky Grayley is an employee there, and she goes to the Connect-a-thon, and I was just trying to learn more about it, so thank you.
Okay, great. Are you guys going to be creating any documents? Are you coming with a system that's going to create documents?
I don't want to say the incorrect answer,
Okay, all right,
so.
no problem. No problem. Objectives, any comment about this? I think I saw Matt Ron on the phone. Matt, is there anything? Oh no, that was Matt Lord.
I think
okay.
he's on PTO this week.
All right, great,
He is.
great, no
Yep.
problem. Okay. So, yeah, we can, well, I'm sure that we'll hear from other people as we go along, but I feel pretty confident that if we can come out of this with having some greater consistency, I think that's absolutely what we're trying to do. And obviously, this is what the ONC is trying to drive us to do. So this couple of slides that I just put on here that Linda encouraged me to crack into before, this one, this PDF is a nice little infographic that gives you a full description of the data elements that are in the US CDI. And the last Connect-a-thon we went through and kind of confessed that many of these that you would think we should be rock solid on, there still continue to be differences and questions and places where we're struggling. So what I plan to do with the agenda in order to support these goals is I have the 2 days broken up in the following way. I'll just kind of run through the quarter plan, but it's a mixture of being educational and kind of that giving and receiving of feedback and consensus building around stuff, and then a heavy focus or equally focused on the doing of having documents be created, having us have time to look at them, and then talk about and fleshing out where there are differences that need to be resolved. So the 2 kind of talking sessions are Q1 and Q4, where we're really investigating or exploring what's going on and talking through examples and everybody's learning. The first quarter has that focus around workflow and what can we really expect in terms of document creation and consumption. And I have a little bit, if we get to it today, I want to ask about whether or not we want to get into talking about reconciliation. I'll cover that at the end of today's session. Q2 and 3, this is going to be the heavy focus on these encounter documents. And today I would like to get a little of agreement. I'm not sure we're going to be able to do it with the folks that we have on the phone. We might have to go back to that next week. But I would like to get commitment around very clearly which document types we're going to be making and focusing on. We can start that conversation today. Then Q4, the focus is on rendering, which is something where we have a great deal of inconsistency still. What can we do around rendering the content? I think John DeMore did a white paper that was published in AMIA where he analyzed 1,000 or more CDA documents and 148 different patterns for how medication information was represented across those documents. And the massive diversity was also looked at by the Health Story Project as a source of confusion and even patient safety issues because of the huge diversity in the way that medication information and other types of information is being represented. We'll talk about narrative text linking to make sure that we really are developing a greater common understanding of what narrative text linking is and how it works. Talk about the section time range template, which we talked about last time, to see if we're making any progress on understanding how to use it. and where it's appropriate, representation of time consistently across different vendor implementations a little bit better, get into that. And finally, we've been asked by the Sequoia Project to have a discussion about when is it appropriate to assert conformance to certain templates, and when is that really irrelevant or distracting information, and how do we provide guidance on which templates should be asserted or not, and get some clarity around that. So that's what we have planned for the first day. Some folks like Matt Lord, who's on the phone today, and Rick Geimer, who agreed to come during Q5. We had a nice pizza session last time, and we did some work on our examples from the examples task force, but we're fingering Q5 this Saturday, the 14th. We'll make time for getting into care plan documents and some of the mapping care gap assessment work. These are sort of fringe topics that are outside of our focus for this time, but still draw some significant interest, and so we still wanted to have them on the agenda, so that's going to be our pizza night. And then on Sunday, this is getting into these new areas. So Sunday will be a discussion about provenance. You know, there's a ballot that's going out as of August 9th, material to review about, it's an informative document about basic provenance information. And we'll be working with the group. Sometimes we have a larger constituency that even joins from the Fire Connect-a-thon as a whole to come and talk about data provenance and basic provenance requirements. And then we'll be spending the 2-quarter session generating narrative clinical notes in encounter documents and generating care team information in encounter documents. And then also exploring and working with the concepts that we discuss here in terms of author and performer and the timestamps that go along with that, and really trying to flesh out examples that kind of go hand in hand with that topic that we'd be discussing in Q1. And we will close the day with the rubric that comes together. These are the rules that the industry says are sort of the best practice things that we are aiming to do above and beyond what the standard requires, and how the US CDI process of continually moving through more data elements that we can understand, insert into the process, and then as a group collectively begin to implement and share consistently. Focus in on that a little bit. That's a big topic for mostly Matt Ron, Q4 there. So that's what we have planned. I'm interested in comments about either, you know, reinforcing that these are important things, or if you think that we have some omissions of things that we have not planned to talk about that you had on your mind. This would be a time to discuss what you see as either reinforcing or challenging what the track agenda should be. Are we on track? Is the track on track?
Yeah, I especially appreciate the inclusion of time representations in the second day. That's a tricky one.
Yeah, I flirted with the idea of reversing these days. I almost felt like a lot of these, not so much maybe the rubric and the US CDI process, although we certainly could. I wondered about whether we should flip the agenda and cover it the other way around, because some of the things that we discuss and talk about in here we could actually be reinforcing them the whole rest of the way through. Or another way of looking at it is we could be like doing it wrong the whole way through, and then like figure out here that we really wanted to try and talk about some other things about provenance and time, and I don't know, I guess the time part I did get into the first day, but what do you think about provenance? Do you think that we should be trying to focus on talking about this sooner, or do you think it's too challenging and it's better to hold it off to the second day?
So I don't think that it's too challenging to hold off for the second day, right? I do think that at least from my perspective inside HL7, like the consensus on provenance and how to do it is still building. And so to put that right front up and center, as to this is how you do it, and you've been doing a lot more work on the basic provenance than I have, but what I've seen is that it's still working things out a bunch. So if we don't have it so tight, putting it right up front may be difficult. Am I wrong on that? I would love to be wrong.
Yeah, no, I think that what you're saying was the reasoning that we originally, when we crafted this, we stuck it on day 2 because we felt like it could derail us from focusing on things we think we do understand and we can be consistent on, which is really what day 1 is about, is reinforcing things that we're already doing. And then day 2 is a bit like challenging us to start some new stuff that maybe as many people haven't been doing yet.
Yeah, I agree with that. So for provenance, it makes sense. And then for the other issues, such as time and just general authorship and performer and stuff like that, I think that a lot of implementers are going to be focused on the relationship between the C-CDA and C-CDA documents, and that those elements aren't as important as how do I show where medications go in a consistent way. So, just in terms of meeting people where they're at, I think you have it the right way.
All right, good. I did cut some things out, and that brings me to, let's see if I was going to talk about that next. I wanted to compare, kind of given that this is how much we think we can stuff into the bag, into the, the size time buckets that we have. I'm a little bit concerned about whether or not we really have time to get into reconciliation. It's a hard topic to draw the line in between consumption and the principles of reconciliation. These things bump into each other enough that it's hard to separate them apart from each other. But we have about 15 more minutes. I wanted to try and show you a little bit about what I thought we might get into with respect to reconciliation, and try to tie that in with the workflow topics and see if you agree that it seems feasible or if you guys think it's going to be too much. I wanted to get that feedback. And then we'll see if we can make any progress on these last couple of slides, feedback around what document types and things. All right. So my goal is for us to agree during these prep sessions what we are going to come prepared to do, what document types and what section types. And I think what I'll do, just because there's such a small group right now, is that next week I will have this graphic that Linda was mentioning that shows, it's sort of a one sheet that shows the different document types and the sections that each of them has. And what we'll do is we'll put that up and I'll highlight it in some way with color or something like that so that we can all agree that these are the sections that we're aiming to do and the document types that we're aiming to demonstrate, so that everybody comes prepared and knowing that that's kind of the pact that we're making with each other. So that if we feel like we have too much or too little, that we're, as a minimum, I think those 5 need to be on the docket, but I'll be interested to see what other ones people feel need to be there too. Recon. Okay, if we start to talk about workflows the supported workflows for basically how would anyone be able to expect that a system can create, that systems would be able to create and send out, make available C-CDA and counter summaries, let's say, or how they would be consumed, that there's certain, do you support that someone could upload them to a portal, which is then manually consumed, or upload them to a portal, which is then automatically consumed, or receive it via a known direct address, or receive it via XDR, which is an ITI 41 push kind of transaction, or consume it as a result of doing a query for the document that you then retrieve. I don't know what people are supporting, but right now we've got problems that no one knows how anyone can expect that a system will ingest a C-CDA document. And we have to somehow start to come to some common understanding that these methods are supported, or what methods in fact are going to be supported that we can all count on. And if they are being consumed, you have to get into what behavior can you expect when a document is consumed. And the best thing that I have found so far about this is in the certification testing, there is something that's called clinical information reconciliation and incorporation. And this set of test expectations, I think, could guide us through what we would expect to see happen in our implementation of Thon. Is anybody familiar with this, or is this the first time seeing it? Linda, do you know, have you familiarized had the opportunity to bump into this before?
No, we don't. We don't
okay.
own an EMR, so no.
Okay, so here's, there's a lot of words on this page, but if you, the links are all in the resources that you can pick up that I've posted up there already. But basically what it means is that there is an expectation that a system who can consume a CDA, that they would be able to properly match to a patient in the health IT module and automatically or manually attach that document, that incoming document, to that patient's chart. The first expectation, you can see that the tester would start out with a document of some sort and then demonstrate that the system can ingest it and correctly attach it to, the tester verifies that the received C-CDA document is properly matched to the correct patient record. So that's one expectation, that you can get the document in and attach it to the right record. The second expectation is that you would be able to support, the tester verifies that data from multiple sources can be simultaneously displayed in a single view, and they focus in on medications, allergies, and problems, on those three sections, so that someone could actually say, this is what's in my system right now, and this is the document I just brought in, and you can see both of them so that they could be compared. And then finally, that the user can create a single reconciled list using the data that was reviewed from the multiple sections and include them into a single list. So this is a big jump from anything that we've ever attempted to look at and see and try. I don't know if it's going to be too distracting or too much, but this is the next frontier in terms of getting consistent behavior and testing at, the implementation of Thon consistent behavior, that all systems would start to be able to do this kind of consumption in the same way. What do you think? Too much, or reasonable to at least start getting it under people's noses to explain this is where it is, these are the rules that we understand of what the expectations are, and how do we start moving in that direction?
We do a variant of that, Lisa. We don't allow them to specify, but we just take specific sections, you know, in the HIE product, and then they can be aggregated into one C-CD. So I think we could do it.
And so, do you have the step where you can see both? You know, I mean, I'm trying to figure out how do we tell if it's right. And so, if we use that guidance where it says you bring something in, now you have what you had before, and you have this new thing. You look at both of them. You perform whatever process you do to support reconciliation, and you end up with one list. And the way that we can tell if it's been done right or not is you compare how the two things, which you could see side by side, becomes the one thing that you call the reconciled list.
Yes, we keep, I mean, I think most systems keep the original documents and that can be viewed, and then whatever you generate, in our case, it would be through IHE cross community or something, right? Request, and we generate what's in the repository. The thing is, it's not going to have everything that was in both CCDs, or not necessarily everything you say to select. It would be whatever we have extracted into the repository. Does that make sense? It's slightly variant. In an HIE, you know, you just extract. In our product, we extract certain pieces of data and then can put those in a unified CCD. But it may not be everything that you know, if you say, I don't know, import the advanced directive, I might be lying. I started to say I don't think that's something we do. But, you know, if it were something we didn't do like that, then we wouldn't be able to show it in the consolidated.
Yeah. But is it something that you think you would be able to demonstrate?
Good question. I'll check and I'll tell you next week.
Okay, that's great, because I think, you know, on the one hand, there's we can talk about it, and then you know, this is informative and just trying to push people to the next level. But if we have one or two vendors that can actually demonstrate it, that's even better in terms of setting the pace, or setting the direction, the aim for how this could work. And you know, obviously we eventually want many systems to be able to do this, and in some consistent way.
Well, and I think because it's a requirement there, most systems would do it, right? Most EMRs.
No, most don't do this test yet.
Oh.
So it's an optional requirement, and not everybody is doing that part of the certification yet. So
I have heard, though, when I talk to providers, they say they let me select what I want to take into my EMR. So I don't know.
Great.
I guess
Great.
EMR question.
Yep. So all right. So I won't put it off the table, because I think it is interesting with respect to the workflow and stuff like that. I'll have to be careful about how much time, and maybe it might just be an informative discussion, and then maybe we'll have one or two people who would be willing to demonstrate what their systems can do. The last thing I want to try and do today is get some sense of who will be content creators. This is one of the weakest spots that we've had, is that we show up for the IAT not knowing who is going to be content creators. And we never have a sense of what documents can we expect to be contributed, what are we going to have, and the whole party falls apart because we don't know who's bringing what dish, you know. So I'm trying to, this list of folks are systems that were at the previous IAT that I'd like to be able to get in touch with to confirm whether or not they're coming and whether they will come and be content creators. And Linda, from your at Optum, are you guys in a position of ever being content creators, or are you solely content consumers? Linda, you might be on mute. Or...
Sorry about that. Yes, I was. We're mostly consumers. We don't ever create what you call original content. We're not an EMR type system. We might create documents from our repository.
Yep. So you might be able to still show something that way, and certainly if you could show consumption and then reconciliation and what you get after, that would be an interesting thing to be able to show. What kind of documents do you think we can expect in the way of encounter summaries? Is it feasible to expect discharge?
I don't know.
Referral note?
I would assume so. Definitely the systems that do hospitals.
Yep. I'd like to be able to say this plus H&P for outpatient. You know, progress note and history and physical give us good samples for outpatient. So for next week, I'll have that chart to show those 5 documents and how they're the same or different, and you'll be able to see how similar they really are, and it's really not a heavy lift at all to do that. I mean, in terms of just what sections need to be included in those documents. I think that's everything for today. Anything that I missed that you guys were hoping we would talk about for getting started down this path that I failed to cover?
Can you hear me?
Can hear you, yep.
I didn't know anything about this meeting, Lisa, and I've been pretty involved. I just happened to be on Zulip this morning and saw the invite there. So I'm wondering how you're reaching out to people.
Well, so far we've been posting things on structured documents, patient care, and attachment listservs. And Dave has been using other HL7 marketing channels like the hl7.org website and maybe some other event calendaring options to make people aware of it. I do agree that probably our focus has been on making people aware about the September 14th and 15th implementation-a-thon, and probably less on the fact that we do these prep sessions to help people get ready to participate in the track.
Oh, so I knew they were occurring. I just didn't know they went the date and time that they started. That's, you know what I mean? I knew you were going to do them. What I'm wondering is maybe if an email should go out to all the people who participated in the past.
Didn't
we do that, Dave? Didn't we do that?
You know, I don't know if we did for the prep sessions. We did for the actual event, and so Linda, I take it you're not part of the structured docs nor patient care listserv, right?
Oh, Dave, I'm part of it. I just don't read it.
That's good feedback. Okay. Yeah, I can forward, Lisa, I'll forward your email from, last week or 2 weeks ago that told everybody about this.
Yep.
Apologies on that, but they get away from me.
Everybody gets bombarded with so much, Linda. I totally agree. And I definitely think that the people who participated last time are the most likely people who will participate again. So definitely let's do a blast specifically to them.
Well, and I know there would be some usual suspects that would have been on today's call. I just have a feeling they didn't know about it.
Yeah. All right, so we'll do that, and post something on Zulip and say, you missed a great session, but I will put the link to the recording out on Zulip too, so that people who did inadvertently miss today, that they'd be able to watch the recording.
mention it on Examples Task Force tomorrow too, Lisa.
Yep, will do. And I will continue to mention it on structured docs too.
See, and I noticed, and I'm one of those people that show up only for the Examples Task Force because I have conflicting meetings. But I feel like there are quite a few of us on the Examples Task Force that aren't on SB.
Yes.
So anyway.
Yes, absolutely. And
you know, Rachel would have been here or had someone here if she knew about it.
Right. All right. Well, hopefully we can increase our participation for next time. We'll do a blast, and we'll amp up our communication about the fact that these are going on. But thanks very much for you guys who were the early participants, and we look forward to chatting over the summer, getting ourselves really organized so that we have the best possible IAT in September.
Awesome. See you next week.
Thank you.
Thanks.
Bye.
Bye.
Bye.